Hi guys! So today we're going to be talking about hormonal acne. What exactly is hormonal acne? Well, it typically refers to acne that worsens around the menstrual cycle. This is primarily because during certain periods in the menstrual cycle, we find that there is a fluctuation in hormonal levels, which can then affect the skin. We know that testosterone, for example, surges just before the start of the menstrual cycle, and that can stimulate sebum production, which is directly correlated with an acne flare. Sufferers of hormonal acne will often report having flare-ups of acne just before the start of their menstrual cycle. While this is generally regarded as physiologic acne, which is expected if it is persistent and leads to scarring, for example, it ought to be treated, in which case it is better regarded as a form of adult acne. The distribution of hormonal acne as well is quite characteristic. We know that physiologic acne that affects teenagers, for example, tends to cause pimples around the T-zone, the forehead, and the nose and chin area, because that's where the oil glands are most concentrated. However, in adult acne, we find that there is a slightly different pattern of involvement. In particular, we are looking at a specific distribution which has been described as the U-zone, which is primarily around the mouth area, under the chin, around the jawline. Now, with the advent of maskne, as I described in my paper published in the Journal of the American Academy of Dermatology, we find that a different distribution which overlaps with hormonal acne can be found in sufferers of acne. If you suspect that you have hormonal acne, it is important to get evaluated by a board-certified dermatologist. There are certain conditions which can mimic hormonal acne in adults, and these would be perioral dermatitis, which really is a form of eczema, and also other conditions such as pitiosporum folliculitis, which is sometimes falsely named as fungal acne, but is really due to inflammation of the follicles due to a colonization of a yeast known as Malassezia fuffa. This yeast proliferates in hot and humid climates. With the advent of maskne, which I characterized in the Journal of the American Academy of Dermatology in my research paper as affecting an area known as the O-zone of the face, there can be both hormonal acne and maskne occurring at the same time. Besides that, we know that certain over-the-counter acne treatments such as salicylic acid, benzoyl peroxide can actually result in a form of irritant contact dermatitis that can cause red, itchy bumps, and sometimes is confused with acne itself. Visit a board-certified dermatologist for an accurate diagnosis as well as evidence-based therapy. Now, a lot of people wonder if facials are the key to treating acne. Well, the evidence in dermatology literature suggests that that is not the case. We are looking at acne still as primarily a disorder that is driven by genetics and the underlying process of inflammation, which contributes to comedogenesis, is best controlled by oral medication when it's moderate to severe in nature. How should hormonal acne be treated? Well, there is increasing consensus amongst dermatologists that all acne should actually be regarded as hormonal in nature. Nevertheless, traditionally, adult onset acne in females is potentially a reason to suspect certain gynecological issues. For example, Polycystic Ovarian Syndrome, PCOS for short, can lead to adult onset acne together with other symptoms such as irregular periods, hypertrichosis, which is excess growth of hair. And it is important, if you do have menstrual irregularities and suddenly experience adult onset acne, that you visit a dermatologist who will recommend the appropriate course of action. Hormonal acne is actually treated quite similarly to other forms of acne, except that if you have polycystic ovarian syndrome, concomitant treatment with your gynecologist's therapy will accelerate the treatment outcome. Hormonal acne can actually respond quite well to certain oral contraceptive pills. In particular, what is dispensed in dermatologist offices is a combination pill that contains an estrogen as well as a testosterone blocker known as cyproterone acetate. It is important for you to first get evaluated, as there may be concomitant secondary infections such as gram-negative folliculitis. A board-certified dermatologist will be able to diagnose your condition accurately, as well as treat any complications that you may have.